Hello and welcome. My name is Rick. This is the Bactrian. This starts my next series on motorcycling and first aid. And this series will be all about the acronym S.A.F.E, S-A-F-E. And S.A.F.E stands for survey. The A stands for assessment. And it will include the ABCs, airway, breathing, and circulation. The F stands for first aid, administer first aid as needed. And finally, the E stands for evaluation. As always, this information is in no way meant to be a substitute for professional medical evaluation and treatment. I would strongly suggest taking an EMT course and becoming trained in CPR to deliver the best care in the field. May God speak to you through these videos and grant you safety and enjoyment through all your adventures. Okay, and we're back. We're continuing with the SAFE series. Just in review, survey the scene, make sure that the scene is safe for us to enter, and then survey the victim, assess their level of consciousness. Are they unconscious, or are they moaning? Are they speaking to us? If they're unconscious, then we want to assess whether they're breathing or not. We need to maintain the C-spine precautions that we talked about in the previous episode, so we don't damage the spine. But if the victim is unconscious and the airway is open and they're not breathing, but they have a pulse, you initiate rescue breathing. So unconscious, not breathing with a pulse is rescue breathing, okay? Unconscious, not breathing, and no pulse would initiate CPR. And again, we're not going to get into CPR. So that's the airway and breathing. Now the C in airway, the C in the ABCs is circulation. So for circulation, I wanted to talk about a little bit of the anatomy and my favorite subject, as we all know, and then move into the assessment of different types of blood. Different types of bleeding, two primary types. And the anatomy dictates which type you'll be dealing with. So, for circulation, we have the heart, arteries, and veins. Those are the primary components of circulation, along with the blood, of course. So when I talk about perfusion, that's the process in which blood is forced through the capillaries and the tissues and exchanges oxygen for carbon dioxide, delivers nutrients, and removes waste from the tissues. I'm not going to talk about cardiac output. If we were in nursing school, we would talk about cardiac output and stroke volume and contractility of the heart and so on and so forth. But we're not going to get into that at this time. So, talked a little bit about pulses before, and I'm not going to get deep into the anatomy of where your pulses are at this point. That'll be in a future episode. So for the first part of circulation, we want to assess the type of bleeding, okay? The type of bleeding will guide our treatment. If we have a oozing, dark red blood, a gauze bandage is going to be sufficient with that. It will, like I said before, the clotting factors will collect in that gauze and help form a clot. And once that clot is formed, a scab will form and the bleeding will stop. If it's brighter red blood that has pressure against it, is pulsing, that's likely an artery and will require significantly more pressure, direct pressure, for a longer period of time, because you're working against the force of the heart and the arteries. The other part of a circulatory assessment is assessing the pulse after you put on a dressing. If you have a bandage that needs to go completely around a limb, just wrap it completely around a limb, we need to assess the pulse distal from that injury. Distal means away from the heart. If we have a bandage here, we need to assess this pulse. If this pulse changes, becomes weaker, feels thready, is what the medical term is for diminished pulse, is a thready pulse, then this is too tight and needs to be redressed to allow for arterial circulation. Let's go to this. Here's one of my perfect drawings that's to scale and perfect in every way. So we have the upper respiratory system here. We have the sinus, mouth, down through to the trachea, splits at the bifurcation of the bronchus, and then the right and the left lungs. Nestled in between there in the mediastinal space is the heart. It's my perfect drawing of a heart right there. It's got the 4 chambers and everything. No arteries in this picture. So we breathe in, comes down the trachea, into the bronchus, into the lungs. And in the lungs, they're full of alveoli. And alveoli is like a tiny pocket where the air is exchanged. The gases, the oxygen and carbon dioxide. So this is a perfect representation of an alveoli. It's like a spherical sac, and there are capillaries surrounding it. And I have blue here representing deoxygenated blood, or blood that doesn't have oxygen in it yet, that came from the body, and then it goes through gas exchange in the alveolar sac, and then is oxygenated as it goes back to the heart to be distributed throughout the body. So there's all kinds of these little alveolar sacs in the lung fields. This is a magnification of one of those little sacs, the capillaries surrounding it, and having the gas exchange to put the oxygen onto the red blood cells, RBCs, we'll talk about those in a second, and get rid of the CO2 that's on the deoxygenated blood that we breathe out, okay? Well, all the gas is in, we utilize the oxygen, we breathe the carbon dioxide out, okay? So this oxygenated blood, there's little RBCs, or these little ovals, they go back to the heart to be distributed, and then the deoxygenated blood, these little darkened RBCs, come to the alveoli from the heart again to get oxygen and go back to the heart and to the rest of the body. Now, frequently venous blood, or deoxygenated blood, is represented as blue, okay? That's just to make it easy. When this goes through the lungs and we have the oxygen put on to the red blood cell, it's shaped like a disc. It has kind of like a plate. It has kind of a ridge with a little divot in it. When the oxygen sits on there, it lightens up the color of it, and so it appears brighter red, okay? So this is the arterial blood. If we have a spurting bright red blood, it's likely from an artery. Again, that's going to require more force in your direct pressure for a longer duration. We never want to be looking under there to make sure it's stopped bleeding. That will be evident by the dressing on top. If that's continuing to saturate, remember from previous episode, we put more gauze on top of that. We keep layering it until we stop saturating dressings. That may be a lot if it's an arterial bleed. And an arterial bleed may require a tourniquet. But again, never do that unless you're someone that's going to die and or you're directed by EMS to do so. So as the red blood cells, RBCs, go through the body, go through the capillaries, drop off the oxygen to the tissues, pick up carbon dioxide and waste, they become darker, okay? And represented as blue, maybe more like a purpley red. But they're darker, it's darker blood than the bright oxygenated arterial blood. And those veins bring it back up to the heart to be pumped back into the lungs. The lungs put the oxygen on it, and it comes back to the heart again to be pumped out to the rest of the body. That's basically the oxygenation of the cells and the upper circulation in a nutshell. So that's how the respiratory system and the cardiovascular system work together to oxygenate the body. So why is an arterial bleed harder to stop than a venous bleed? As the heart sends a pulse down an artery, it's expanded by that volume of blood, and it has a heavy muscle layer that recoils and contracts and helps push that blood even further. So in this perfectly anatomically correct picture, I have a heart here, the four chambers, and we have the left ventricle. It's much larger, it's a much thicker, larger, heavily muscled ventricle. The others are small. This is the right ventricle, much smaller in comparison. The right ventricle gets blood from the body and it's pumped into the lungs like we showed before, and then it's pumped back. It goes from the left ventricle through the aorta to the rest of the body. Now, this is a perfect representation of a artery. They're big and they have a very thick wall. It's heavily muscled. They have muscle bands on them. And then when that gets stretched, all this muscle contracts and sends another pulse. So we have the force of the arteries with that heavily muscled body pushing the blood, and the force of the left ventricle also pushing the blood, as opposed to a vein, which is far less muscled. It has very little muscle in the wall, and the wall is much thinner. Outer surface is far less muscled than the heavily muscled artery. So the force of the blood pressure in the vein is much less than the heavy pressure in the artery. Arteries are also run deeper. They generally run right next to a bone, and so that's harder to get compression onto that vessel, onto this artery, to seal it off because they're so deep. Whereas the veins are typically closer to the surface and much easier to put direct pressure on, collapse this tube, and stop the flow. That may be why a tourniquet is necessary to stop an artery from bleeding than a vein from bleeding. I hope this was helpful in explaining why it's important to recognize the different types of blood and different types of bleeding so that it will guide your treatment. If you see that darker red oozing blood or even flowing, you know that that's likely a venous bleed and just will require some direct pressure until you get some stasis, that blood to stop. If it's a spurting, light colored blood that's like an arterial bleed, it will take a lot more force directly on that wound to help stop that bleed. And if the person is losing consciousness, becoming pale, etc., from blood loss, they may need to have a tourniquet if you're guided by EMS, or they're going to die. If we get it too tight, if we have a bandage that is too tight, we can lose the pulse beyond that dressing, the distal pulse. So we want to assess that before and after dressing a wound to make sure that the dressing isn't too tight, we're still having circulation. Also, the tissue, say if I have a wound here, the tissue of the hand will swell, become cool, change color, be pale, blue, etc., if we have too tight of a bandage here, along with having a change in the pulse, that thready pulse. I always feel pulses with 2 or 3 fingers. It gives me an idea of how it feels as it's traveling down the artery. And if you feel with 1 finger, you don't get as much data on how that blood is moving through. If I have 2 or 3 fingers, I am feeling that pulse of blood as it goes through. If it's limited, it's going to be that thready, very weak. You can feel on your own wrist right now, and that hopefully is a normal pulse and how your pulse should normally feel. And that'll give you an idea, if you find something abnormal, how that will be different than what your pulse is right now. Thank you for tuning in. I'll continue with the S.A.F.E series next week. Thank you. Preserve sea science vein that goes from the body is the vena cava, and the heavy pressure